should be the guys because we're like, yeah.
Gary?
This has been amazing, hasn't it? I know it has been amazing. Thank you so much for starting to wind up your conversations as we find our seats and come back to center stage for the last stretch before lunch. Let's come back to our seats and wrap up our conversations. Thank you so much for being here. Let's get started and wrap up our conversation so that we can start our next session. I'm so glad there's exciting conversations going on. Let's make sure we wrap them up and find some seats so that we can get started with the next part. Thank you so much for being here. Great. Find your seats again, and let's get the conversation back to the center as we look into perspectives with our early career researchers. Thank you for being here. Let's find our seats and seize our conversation so that we can look back into perspectives. All right. Thank you. Thank you for being here. Cheers. Thanks a lot. Okay, find your way into a seat again, and then let's bring the conversation back to the center. I'd like to invite our early career researchers. We had a team of reporters yesterday. Sean and Mina and Adam and Siddharth and Cameron, Violet and Grace were tasked with capturing what was going on in the conversations yesterday throughout the day. And so in the next hour, we're going to explore these perspectives from their perspective. So they went around, they listened carefully to everything we were doing and the conversations we were having, and we're going to go over that summary. And let's see what the next generation of scientists that are going to be using this Bridge2AI data have in mind and how they synthesized all of the activities from yesterday. So they'll help us go over on these overarching themes, and I'm going to let them come to the podium as the slides. I'll help you with moving slides, but please come over. I think Violet will start us off. So you can use here. When you're ready to move, you can move either with this or that. Okay, thank you. Sorry, let me grab this.
All right. So synthesizing insightful contributions. So one benefit we picked up was that based on what we saw yesterday and how will the Bridge2AI data and infrastructure specifically accelerate your ECR's careers in ways that weren't possible before. And so we got the idea of collaboration, shared expertise enhances the work. And then we also saw that connecting on the ground experience and policy in ways that have not been done before. When it comes to evolution, we looked at how is the soul of Bridge2AI shifting from collection of data sets to a wisdom-driven community. And so for that, we were looking at possibilities for the fate of projects when the funding ends. So what are we going to do next? And that pertained to certain things like trainees having access to the data continuously, publications and various infrastructure around that. Getting away from the data sets and also shifting from data generation only to training people to use the data. And so that, again, is just investing in trainees so that we know what to do with the data beyond just having it. And then passing the torch. If you're an early career researcher, we are here to carry this torch. And so what are some barriers we face that need to be broken down in the next 12 months. And for us, that was really just funding. And so pushing towards transdisciplinary experience. So we have a lot of different people in the room, from clinicians to data scientists to subject matter experts on something, say diabetes or SUD. And so how to get us all together working towards these projects, because something that was brought up, we'll dive into later, is how all of us have these ideas and questions, and we really all need to come together to solve those. And therefore, covering the data lifecycle, again, allowing it to go beyond just the funding cycle continuously. And then again, broad spectrum of funding. Something that was raised was that there are a lot of voices when it comes to this data. Obviously, we heard from the clinicians, data science, and subject matter experts on various diseases, but something that was raised was things like policy and history and like other domains of knowledge that would be important to these discussions when we think about not just creating papers and publications and these algorithms, but also moving towards implementation in the hospital system, and then drawing in people from like lay people into the experience so they can garner our trust and not kind of just being in this scientific bubble. All right, thank you. And now we have Adam, who will present next.
Hello, everyone. So yesterday, fireside chat was amazing in the sense of how much I will say I learned, and I discovered that there is much that we can learn from Bridge2AI. For example, we have the biomechanics crowdsourcing. This is something personally I see as very engaging as we look toward the future of how we can use, for example, Bridge2AI data set with crowdsourcing, for example, collecting additional data as a second source. The other things that I liked very much is the education integration. I am wearing here my second hat. I am an adjunct faculty with Purdue University. And one of the things that I'm teaching my students is genomics. And the Knowledge Center platform provides a great opportunity for the student to learn how different domains of knowledge and interconnected. And I'm going to include that as part of their learning. From the people from the large industry, from Philips, I think her name is Veronica. My third hat, I am a small business. So one of the things is that how can I collaborate with large businesses and build partnership? And Bridge2AI can answer these kind of questions. Then there is the expanding outreach. And again, I'm going to wear my educational hat. And I have shared Bridge2AI training with my student. And I encourage them to submit their application so they can learn more about the opportunities that Bridge2AI data can offer. Thank you. Sean.
Good morning, everyone. More detail will be in the full report that comes out after this wonderful 2 days we've had. But there were certainly some insightful contributions that came out from the Wall of Impact. And some of them, we started to notice a couple of sleeper ideas that these were really undervalued ideas that we think really should be elevated. In particular, where is the funding? We asked, where's the funding to connect the products of Bridge2AI to real world issues? And I think in particular, the disciplines in social sciences and humanities, social cultural anthropology, a few people came up to me today and said history as well, and certainly policy, I think are particularly needed. In fact, some of the questions we heard in the comments on the stage today really led to those arenas where we don't have people necessarily in the room speaking on those topics. Certainly another sleeper topic that came up are concerns about health equity. Certainly the communities involved in the generation and use of the data, of accessing the funding and the resources to do this work, AI equity, all sorts of questions about mitigating bias in a host of different ways. So I think there's a lot of work that oftentimes the scientists that are working in a data set may not necessarily think about, but some of the colleagues that might be on a different part of campus might be able to contribute. Some thoughts also, we had a nice robust discussion about the NIH reaction and what the leaders really were discussing. We thought we'd mention one in particular, and it came up in the last session as well. The long-term a repository for the Bridge2AI data is certainly still being discussed and under consideration. And many questions, of course, need to be addressed about data access, sharing, dissemination. We heard quite a bit about also about reconsenting the information and such. More information will come out in the future, but I think this is a nice thoughtful piece or two.
Good morning, everyone. So today I'll be synthesizing what we discussed and heard about in the lightning pitches. First, I'll talk about some of the core themes. And across the pitches, we saw three different things that basically stood out. The first would be the multimodal ideas, and we also heard that this morning, as well as data integration. Almost no one was relying on a single data source anymore. Everyone was combining things such as EHR data, wearables, waveform data, imaging, and even molecular data to capture the full picture of patients' health. The second core theme would be longitudinal and trajectory-based modeling. This is a clear shift away from those single time point snapshots that we're used to towards understanding how health actually changes over time. This showed up across different pitches, such as ICU care, chronic disease, diabetes, as well as substance use disease. The focus has been less on what's happening at one moment and like how these patients are moving and evolve. And lastly, our core theme would have been clinical integration. Many of the pitches emphasized building tools that actually fit into clinical workflows, not just the models that perform well, but the tools that clinicians and hospitals can realistically use in decision making. From there, I'll discuss the collaborative gap. And a consistent theme that we noticed in those pitches as well was that need for better data and stronger collaboration. Many groups are looking for access to high quality clinical data, continuous monitoring, as well as waveform data, as I previously mentioned. There was also the clear need for implementation partners, and the cross-disciplinary teams that can help translate these models into real-world clinical environments. And lastly, I wanted to talk about the curious subjects that arise. A couple of ideas stood out particularly interesting. One was the use of these continuous glucose monitoring and the ICU trajectory data to move beyond traditional static measurements and better capture real-time physiology. Another was longitudinal multimodal AI to areas like substance abuse and recovery and hospital-based outcomes, with a focus on models that could actually be adopted in practice rather than just staying in the research space. So to close, I'd just like to say that overall, the field is clearly moving towards a more integrated, time-aware, and clinically usable AI systems.
It's hard to follow those summaries, but what we've done, and you can still see the walls of impact and you can see the dots. What we've done this morning is we looked at what the top solutions are and we try to synthesize them in those, those emerging themes. And as Sean was saying, we hope to produce a more comprehensive report. So none of this wisdom will be lost. But a few topics that emerged are we do identify technical solutions and foundations and standards as an area of need of attention. And some of the solutions you can see here on the slide is we need to continue working on harmonization and paying attention to those multi-model data sets that already are in the Common Fund data ecosystem and that those projects that are represented here are creating. But we also need to think about the curriculum and how we invest not only in the data, but also in the people who will be using that and providing that and creating that pipeline, not only for the models, but also for those who will be creating and those who will be using them. And of course, all of that needs to align with explainability from the pre-model and to end-to-end implementation so that it makes sense to clinicians. You've heard the questions earlier today. Does it make sense to the public health departments who will be hopefully implementing those models and changing the health of all. There are also discussions and solutions that align with operational sustainability and scalability. How do we share, how do we preserve the knowledge locally from what this consortium is creating, but also how do we make sure that the tools are maintained over time? Because we know even if we succeed of bringing them in after we build it, those tools and the technologies are so rapidly developing and evolving that a year ago we didn't talk about agentic AI, and now this is the buzz in the room, right? How do we invest in those not losing the momentum that is created here? We also recognize that there were some lessons learned from this consortium, from the projects that we're implementing, and again, it's that topic of maintaining knowledge, preserving the wisdom that we have generated here. Also related to that, and as we think of translating all of this knowledge, are how do we create scalable AI and provide participation? And perhaps the models and tools they need to be very high and complex so that we can push the edge of science and the knowledge, but they also need to be easily implementable in real world settings and health systems. And finally, ethical oversight, establishing the shared language so that we don't have to not only rebuild and reinvent the wheel, but maybe not rebuild the bicycle, right? If we already created that. But that requires the expansion of ethics, the understanding how the ethical considerations are allowing us to bring on the stakeholders, bring on the communities that ultimately will be using that. And so all of that comes back to really the pillars that this project, this consortium is all about, right? It's the data, it's the people and the ethics, and you can see how they're interwoven, and we cannot really pull them apart. We're trying with the solutions, but it comes over and over again that in all of those walls of impact, you can see the threads of all those three themes. Thank you. That was my slide. And now to Sean.
We had a rather robust conversation with ethics, and I ended up preparing about 9 slides, but we decided we don't need to talk about all of it this morning. But when we talked about what are the critical ethical problems, I really started to see a theme that many of us have discussed, is that the ethical practices are not keeping up with the AI systems. There was a lot of concern in our group that ethics was really concerned and concentrated more around compliance. And that's the way that people were thinking or engaging with ethics. There was certainly concerns that the preclinical and the data generation phases really weren't thinking about the implications of what we were collecting, that there was really a lot of direct action to collect the data and then figure out the ethical implications of it later. Certainly the downstream use, what I call the real world, is not necessarily informed into this collection. And I would say that the group largely thought that ethics was being treated as an add-on, not necessarily some sort of core design element. There were also, I think, a trend of kind of a view that the ethical gaps were really system level failures across the entire research pipeline. I believe there was we believe there was a mismanagement between the data collected and the real world application. Certainly concerns about data integration and usability, a lot of concern and robust discussion about the exclusion of communities that are generating and affected by data. And I think this can both be research communities, communities within institutions, as well as communities in the way an anthropologist might talk about them in our own neighborhoods. There were a host of questions that came up about accountability in a host of different areas, and as well as concerns about data leakage and maybe surveillance issues with the data. And then there was some discussion as well about environmental impacts of data systems. And there was a little back and forth about how to address the environmental impacts when folks may not have necessarily had the expertise to do it. I think when I look at the conversation we had, there's some interesting ideas that might come up about why the gaps persist. And again, there is this over-reliance on IRBs as a proxy for ethics. IRBs are not about ethics. Well, they're about something else. I won't go there. And I think in part that the teams don't have ethical trainings beyond compliance. And teams and the interdisciplinary teams need to have that. And that speaks into the conversation we heard a little bit of earlier today about the transdisciplinary or interdisciplinary, hopefully transdisciplinary integration. When you bring those different teams together, you start to look at the ethical questions in different ways. We did have a conversation about the binders, the disciplinary blinders in research. So I view the question of who's getting access to the funding, and that's both in the way that NOFOs and special emphasis notices might be written to exclude or exclude certain populations. So there are disciplines that are not being invited into the room, and these funding structures that do come out really end up prioritizing speed and outputs, not necessarily the ethics works. There was also discussion about the standardization of maybe a life cycle governance model, as well as a lack of real world research, which might also inform some of those ethical questions as well. There was certainly a lot more than we shared today. And again, we hope that comes out in a future report.
So this is what came out of the Solutions Corner that focused on AI scalability and participation of resource-limited research institutions and health systems. This is like a high-level model of that. So there, we all, we also heard to the NIH leaders earlier talking about trust and value gap. So there is, we need the leaders to be convinced about the AI ROI. There are unclear benefits to care and operations, and their competing priorities. We need to address that. We also have to, kind of look at the infrastructure and people where we have to develop that resource, that workforce that can help, adapt or adopt AI solutions at the resource limited research institutions. So not just the ITs and the nerds, but not just creating that. So the people who are on the ground, the CEOs, the IT, the providers, patients, we have to, develop cross-institution collaborations, standardized tools and shared data models through collaborations so that we are able to, help the resource-limited research institutions and health systems. And then, of course, there is the cost. The relevance has to be understood. So this is the broad picture. And the action strategy that came out of it is let's identify what the resource-limited research institutions really need before we push these solutions on them. How can we encourage their participation? How can you encourage their, improve their infrastructure? How can you make them understand the ROI around it before you engage them? Engaging the champions early on and aligning with the community priorities are needed for, even to make that leap from, resource enriched research institutions to research limited research institutions. And I just want to talk to you about, so the aha moment in that corner came from, is it just enough to create something cheap and portable and push that on the resource limited institutions? Maybe that's what they need. Yes, give us what you have already trained your foundation model. We will fine tune it and we'll apply it at our centers. So the answer is no, cheap and portable is not the answer. The solution needs to be more specific to the task or the problem that the community faced, where that resource limited institutions reside. And then engage champions and advocacy groups at these organizations via surveys and focus group. I think that's all I would like to say that came out of this corner.
So to Mina's point, actually, that it works very nicely to our corner number 3. So believe it or not, this is not how our corner looks like. This is AI generated. And I can tell you how intuitive this AI is. So let me walk you through this graph. So, so in the corners and the top and the bottom, those are our questions. Those questions are the ones that are driving our discussions. And based on that, we come up with 4 domains. The first domain is financial sustainability, technical resilience, human and capital and knowledge capital, and last, governance and risk management. So if I ask you, how many of you see yourself in preserved subject matter expert? So we have so many dots. But if I ask you a question, I don't know how many of you will raise your hand. I'm just wanted to see how we can beat this number of dots. Any take? How many of you? So for example, myself, I see myself in this bucket, very important. I would like to preserve my knowledge, but as well, I would like to increase knowledge. And and if we can preserve the knowledge that we have right now and add to it, it will be like AI wouldn't exist. It will be catastrophic. You can imagine the chaos that can generate that. So the second most important one is dealing with missingness of real world data. This is very critical. I think most of us as a researcher, would like to have complete data about our subject. And I think that's spot on. And last, we have established new funding models and access to by free structure. And I think all of us, we think about sustainability. I think as for sustainability, I don't know, like from your side, how you are thinking about sustainability. And I think that the corner 3 hours, we thought about it, but still there is questions that needs to be asked as a community so we can find new ways. Thank you.
So building on the sharing aspect of Solutions Corner 3, we were talking about how we will share Bridge2AI with new researchers. And one thing that kind of came up pretty often was this idea of a last mile issue where a lot of trainees were, they had no problem getting a lot of content about how like 10,000 foot overview content and details about, how neural networks work, but they were also at times left wondering how to actually, apply it to apply it to the data generation project outputs. So that was a big ask from a lot of trainees. Just some more content about projects and lessons actually applying these lessons to the DGP outputs. And secondly, another thing that they brought up is that cross-disciplinary teams and infrastructure for cross-disciplinary team building would be helpful in this respect. But that led us to a second point of discussion, which is that early career researchers sometimes felt that they were stepping back from the lead just because they knew that they had, gaps in experience or knowledge between them and the data scientists or AI engineers. And a potential solution we discussed to this was having a shared vocabulary map and mind map to assist learners, a resource that would persist on after the data collection phase. And finally, an ask that came up a couple times was for a way to individualize the curriculum to efficiently address learners' gaps. And so a couple of things that came up to this are, first of all, interactive, choose your own adventure kind of lessons to allow choice for how much depth folks wanted to engage with the content in. An interesting idea that was particularly popular was using an AI-based tutor in order to meet these differing demands for engagement. And then finally, a third idea that came up was having a tutorial feed being published and letting folks subscribe to topics of their interest so they could selectively pick what they wanted to visit in some more detail. Thank you.
All right. So our solution corner, I actually didn't mean to put that question mark there, but It makes all of the sense because that's kind of where we ended up at the end. I wouldn't lie to you. So, but yeah, that was totally an accident. So our central question around explainability was, how do we actually benchmark explainability? And the first key point was that explainability is not just about the model. It's about the entire pipeline, from where the data comes from, to how it's selected and processed, to how the model generates its actual outputs. All of those steps actually help shape what we're trying to explain. And in many cases, the pre-model steps are actually driving the behavior as much as the model itself. Secondly, we discussed that there is no one size fits all type of approach. Explainability depends on the audience. What a clinician needs is going to be different from what a patient needs sometimes, to a data scientist, or even what a decision maker needs. So any evaluation has to reflect those differences that lie within explainability. Excuse me. Thirdly, we we discussed that there's no single benchmark, which is the question mark at the top, right? The discussion leaned us towards the idea that multiple context-specific approaches may actually be the most appropriate than forcing one standard across all cases. What makes this difficult is that explanations are not always stable. Different methods can give different answers, and a lot of the influence comes from data quality and pre-processing steps, that are often hidden within the data. Most importantly, what counts as a good explanation really depends on the use case, what decision is being made, and by whom this decision is being made. This also ties us back into equity, because if the data or explanations are biased, then that's going to directly affect who benefits from those models and who does not. Underserved communities and so on and so forth. So the bottom line here is that there is no single benchmark for explainability, and instead the field is moving toward a context-specific ways of evaluating it, grounded in real world and equitable decision making. Thank you.
Okay, so for solution corner 6, we're all about multimodal data harmonization. Our main challenge was fragmented multimodal data combined with inconsistent standards, which limits harmonization of that data. And so we have a lot of topics going on. Obviously, this was an AI generated image based on the feedback we had gotten from our corner. There are some overarching topics that were kind of discussed earlier. So data standardization, when we think about the foundations, when it comes to the structure, we talked about how we should move towards shared nomenclatures, anthologies, and consistent mapping, so that when we have these different data sets, it's easier to bring them all together. Another thing that was talked about was metadata quality. So having a complete context of site, possible date, time, sometimes with numbers, sometimes the units aren't there. This will allow, for instance, if different sites are collecting it differently, and easier to standardize it within site and then harmonize the data together. That was discussed. Integration, so workflows and validation of that data. When we think about joining across different modalities, being able to, if we're interested in something that is time point dependent, so linking waveform data with an actual, say, clinical interaction that's happening at the same time. And then thinking about sites as well. When it comes to pre-processing transparency, that was kind of discussed before, thinking about the different documented assumptions. So when we have something like waveform, this was talked about in our group, there are assumptions that the data scientists kind of have to make when it comes to frequency rates for waveforms. And so that can cause data drift that then, as scientists, maybe we're not aware of happening, and then incorrectly decide that that is actually some kind of clinical biomarker when it actually isn't. It's actually an artifact of the way the data was collected. And so we're thinking about, again, having some kind of documented assumptions for this kind of very messy dynamic data that we're using, so that when we do have insights, we know if they are actually true insights or just artifacts. And then again, benchmarking validation, we've talked about this, assessing the integration, improvement, and workflow metrics. Something that was talked about in our group was that when it comes to benchmarking, it's kind of like a moving target. There is no one best thing. And so perhaps we need to create one for the data set we're working with. And that oftentimes the benchmarks that are used come from other data sets and not the data set we're currently using, and how that could be problematic moving forward. And then sustainability, longitudinal, and support. So when we think of longitudinal data readiness, we were thinking about better visit timing, perhaps some kind of continuous enrollment. So people who are part of this during the time of the actual grant, so that 5 years perhaps, being able to perhaps have patients opt in to continuously be monitored via, say, a wearable, something of that nature, and then thinking about how we can put consent into those models. And then user support infrastructure, again, this been talked about, some kind of help desk, perhaps AI assisted, FAQ. So again, we have that data or insights from people who are in the phase 1 going into phase 2. But even in my program, having insights from cohort 1 being in cohort 2 is really valuable. And so allowing better guidance for users. And then last outcome, ecosystem leadership. So community leadership, set some kind of field-wide standards, opinions for leaders for AI-ready data. And so the idea was that is perhaps we should actually come together as a consortium, as a workforce, and write some kind of 50+ author paper that kind of talks about the kind of standards that we should be thinking about when it comes to this research. Therefore, the people coming forward will have, again, some kind of benchmark to work on. So thank you.
All right, and the final solutions corner was number 7, which focused on lessons learned from the Bridge2AI consortium. So we really took a historical approach and went back to the very beginning of the project. And a really big theme that emerged was how much time it takes at the beginning of the project to kind of set the stage, set clear expectations, kind of agree upon the necessary collaboration things to move forward. People had brought up that if the expectations were kind of clarified at the beginning and the framing was there, then, the mixing and matching of teams maybe would have been better received. And they also talked about, even back as far back as the RFA process, it may have affected like who applied in the first place if they had clearly understood what this project was going to look like and what it would entail. So the key takeaway was kind of, we can't expect results and the data to come out of this immediately. It takes time, even like the first year, to really build these collaborations, get to know each other as people, and be able to work together. The second big theme that emerged, again, we've heard this time and time today, is to invest in the people, not just the tool and development. So a big theme was that the training and the knowledge that has been gained throughout this process, building these data sets, has been extremely valuable. And it's important to try and build consensus and build those groups up instead of trying to make them compete or compare them. And again, investing in people also means like finding that continuity as we move into phase 2, preserving that institutional knowledge, as well as, sustainability of data governance and all these other things that we've been talking about. So the key takeaway here is that, the general perception a lot of times is that AI will replace people. But what we've seen through the Bridge2AI model and through this project is that really we're trending towards collaboration, training, and building kind of the next generation of researchers. I believe that's it.
I would like to invite all of our reporters back over to the stage. So come on over, all of you who just spoke. Yes. Yes, let's come over here. I just wanted to show you, I introduce you to the next generation of scientists that will be using our data. These 7 voices speak for all of you who are in the crowd, who presented yesterday through lightning pitches, who brought your research through posters, who attended our meeting for the first time and are hoping to be, users and scientists who form careers about all of the data that is being generated by the Bridge2AI project. And I find it incredibly insightful. It's invaluable to see the things that they picked up as we were having our discussions. And so I'd like to thank you for taking the time to do this exploration. And now I would like to open the floor for questions from across the consortium about the topics we discussed. So we can do a little session about all 7 corners, or we can go deeper into some of the thoughts that we had from yesterday. So This is your time. If there were some unanswered questions you had yesterday while we were discussing, please come over to the mic. If these insights from today sparked some new ideas and you'd like to share something your group is going, you would like to share something that was an unfinished conversation, we'd love to hear from you. And so you can take a seat whenever you're ready, and then we'll just have a new Q&A across, and then we'll help moderate. So any thoughts? Any questions? I can bring up the 7 solution corners into a different slide so that you can all see them. I think they're here somewhere. Okay. Thank you. Go ahead. From the front, flip the switch up. Yeah.
I just wanted to add on the online sessions that happened yesterday.
Yes.
When I was listening to the report backs just now, there's so many similar sentiments. We didn't get to cover all of these corners, but the corners we covered reflected the idea that we need community stakeholders to come together to harmonize data, to learn from lessons learned and best practices. So I just wanted to voice those people online. That's all. Thanks.
Thank you. Thank you so much. And so as you know, we had yesterday online version and on-site version, but we did not have a hybrid event. So thank you so much, Grace, for leading that and getting that insight. As Sean was referring to earlier, we'll create a report with all of this information for our own benefit, of course, and for NIH to be able to get the insight from the community. Harry.
Hi. So I know the multimodal data corner touched on this, and I think some of the other corners did as well. Just the idea of the pressing need for more adoption of consistent vocabularies and ontologies, and that's certainly something that I'm interested in. But I'm also curious if anyone has any more discrete ideas about how to further this process where people realize that they want to be able to use a given vocabulary, ontology, or other kind of controlled system. They check it out. They realize, oh, okay, this doesn't actually represent what I need. How do we keep that process going and ensure that those vocabularies and ontologies can adapt to their needs without having it just kind of immediately stop there? But I'm especially in the Bridge2AI context, because I know there's still a lot of areas where people would love to be able to represent their aspects of their data, but the existing vocabularies and coding systems just do not support it.
Thank you, Harry. Do we have some takers? I have ideas, but I don't want to dominate this. Come on, Tim Clark. I know you're somewhere. He says, I don't know what Harry was asking. Does anybody have some thoughts on this? Camille is pointing to her next door neighbor. Do you have some answers? So one of the things so Harry's asking, like I have all of these incredible body of knowledge that the data can provide me. I'm trying to organize it, but I can't not quite find the semantic support to represent accurately all of these data. How do we improve this? And so one of the steps that we have taken from the standards working group perspective is we sat down and inspected that there might be some ways in which we can approach standards development organizations and bodies that actually are working with these ontologies and letting them know, listen, I am this Bridge2AI project. We have these incredible data sets. We couldn't accommodate the OMOB common data model to be able to represent all of this information. We have these proposed expansions, so reaching out to those organizations. I think I saw Chris Schutt around earlier. With Dr. Chris Schutt's leadership and others in the team, we actually put together a short manuscript in which we described this process of reaching out to standards development organizations and letting them know how our work and what we have done is informing the extension of these data sets. And so that's one way in which we are trying to figure out this path to better representation of the data. But Harry, did you have some ideas on how else we could help Were you thinking more about the validation process? Were you thinking more about just expanding knowledge, vocabularies and ontologies in general? All of the above. Let's grab you a microphone.
Yeah.
Sorry.
I think even just the kind of the immediately tractable things like somebody realizes, oh, I want to be, I have already data that's coming in from something that's aligned with fire. I've expressed a whole bunch of, EHR level data in here. I have some additional data I want to attach to that. How do I go about actually getting that in OMOP? And they may have probably done their own research and said, okay, well, OMOP doesn't actually have the terms that I need for this. Are there other vocabularies that I can use? They probably even get to that point. But I just don't want them to stop immediately when they hit that point of realizing, well, these vocabularies don't exist and I don't want to make them. So I guess I just won't use a vocabulary. So is there, and I don't know if there's kind of an easy way to solve that other than, I think that working with SDOs is probably one of the immediate ways.
And thank you so much. And I also wanted to make sure we let know. So yeah, El or someone representing voice, Eric or someone representing chorus, and Aaron and Cecilia or someone from Salutogenesis, Trey and CN4AI, that we are actually working on making connections with standards development organizations as well. One of the things that we're going to be doing in this extended period for the Bridge Center is actually bringing together standards across Bridge2AI and the Global Alliance for Genomics and Health, GA4GH. So we are making these connections, and hopefully we can help you cultivate and expand however you need to for your own data representation. Okay, how about Joe, you ask our next question.
It's not really a question.
Okay.
Just a comment. So the gentleman in the front row talked about bias in the data. Sean, who talked about making these things sort of pre-designed with transdisciplinarity in mind. We tried to do that, especially with like a good quality survey of the social determinants of health that's informed by people of color. Right. So people of color often in this environment sort of blend in and they go along to get along rather than trying to say the things that need to be said. And the data is biased, right? So like, what is a Black person? Is an African American the same as a continental African or Caribbean? I don't know. And right now, they've lumped Pacific Islanders in with East Asians and South Asians, which is not a category, right? They just get all lumped in together. And you don't hear any of the good stories. Like there has to be somebody in the loop, in the AI loop, to make sure the data is of good quality, right? Because the definitions or the standards that you were just talking about are created by somebody that's not us, right? So, and then you don't get to hear the good stories. So like in the last 6-7 years, Mexican Americans have been the longest living population in the United States, passing up white Americans, Black Americans, and Native Americans, right? And so it's not a genetics issue because Mexicans have as much, if not more, indigenous ancestry than Native Americans do in this country. So like all of these things, this deficit model type analysis, I think, is just to get funding. Like, oh, Native Americans have type 2 diabetes, so we'll give them funding. Like, why don't, like the project we're in, AI Ready, with Aaron and Cecilia's Salutogenesis, it's like figuring out why people in certain populations remain healthy and they're not in this deficit model. So I think there just needs to be more of people in the loop and people of a diverse nature so that they make sure that the data says what we think it says. Because, and I know I'm not an AI guy, I'm not a data guy, I'm not a biostatistician, but I know from that camp, there's an argument that if you get 1 trillion points, all the noise will disappear and you'll come up with the truth, which I don't believe. Because we had a study in South Dakota on the reservation where I live that basically said type 2 diabetes was a genetic liability. But they didn't know that on that reservation, the women tend to marry white men, right? So the men who don't have money, they don't have a ranch, they don't have cows, they don't have a pickup truck, end up single and obese with no car. And so they end up dying early. So they didn't do pair matched wise assessment of those people to say, of these people of the same type, where does the type 2 diabetes lie? And they just said, well, here's a group that's biased because of socioeconomic effects and social effects, to Sean's point, because all the Native women were marrying white guys and all of the fat brown guys were dying of type 2 diabetes. So like these things are not known by general researchers. So I'm just saying you need more people of color, making sure the data says what it's supposed to say.
Thank you.
I participated in the explainability corner and I thought I had a really great time and the discussion was very insightful. So my quick question is, how do we keep the conversation going? I hope this is not a 1 year thing.
No, it shouldn't be, right?
So what's the mechanism to keep it going?
That's a very good question. Thank you for asking that. So what do we do next? Producing a report of the things that we actually sow as insights, I think will be our first step. We have the possibility of connecting as a community on Slack, so we could create maybe a workspace where we can start this conversation. We don't have a specific working group for explainability, but the standards working group, we actually covered the end-to-end explainability as one of the aspects of determining whether or not the data sets are AI ready. So this conversation could very much fit within that, the space of the standards